We are honored by the opportunity to participate in this webinar with leading international sports specialists, and we would like to share with everyone our small contribution to the world of hamstring injuries in sports. In the past years, outstanding literature has been published describing classification systems to help define prognosis, return to sports criteria, and protocols to lower injury rate following hamstring injuries in athletes. In the same way, research based on therapies that could lead to an earlier return to sports have been performed and are of key importance for team health providers. Inspired by the excellence in research of our colleagues from Aspetar and other outstanding sports leaders around the world, we conducted the first report on hamstring injuries in a professional soccer team in the Major League Soccer. The purpose of this study was to identify specific injury patterns, the location and the severity on MRIs following acute hamstring injuries in a group of MLS players. The secondary purpose was to present a new MRI classification describing the location of hamstring injuries. Relevant data related to the mechanism of injury was collected from the available records. Detailed description of MRI findings were reported. This included the muscle affected, length and grade of the visible edema, total length of the hamstring, and the distance from origin and insertion to injury, severity of fiber disruption, low, moderate, or severe, and zones involved. The zones involved in the injury correspond to the classification proposed in this study, in which the full length of the muscle is divided into 5 zones. Zones 1 and 5 correspond to the proximal and distal tendon, respectively. Zones 2 and 4 correspond to the proximal and distal myotendinous junction, respectively. And Zone 3 correspond exclusively to the muscle belly. Here we can see a table showing the distribution of hamstring injuries in our group of patients. A total of 19 reported hamstring injuries were evaluated by MRI. All patients were males with an average age of 25 years old. MRI was obtained in an average of 16 days from the initial injury. The most affected player position corresponded to midfielders, and most injuries occurred during the early season followed by late season period. Running was the most common mechanism of injury among players, and almost 60% of the injuries occurred on the dominant leg. Interestingly, 74% of the cases involved the distal myotendinous junction, and 79% of the injuries affected more than one zone. All injuries presented with a severity of fiber disruption either low or moderate grade, and secondary findings on MRI were reported as well. The biceps femoris long head was the most common injured muscle, and in multiple cases it was injured in association with other muscles of the hamstring complex. From our available data, 2 re-injuries were reported during this period, and both corresponded to the distal myotendinous junction of the biceps femoris long head. This MRI anatomical division with 5 zones and radiologist detailed injury description helps identify injuries predictive of higher time lost from competition and higher re-injury rates, including injuries involving more than one muscle, presence of muscle retraction, length of edema, involvement of the tendon, and severity of fiber disruption. This is the first study evaluating hamstring injuries in an MLS team. The findings of the current study support the previously published international literature reporting a prevalence of biceps femoris long head injuries among soccer players. Interestingly, injuries affecting the biceps femoris have been associated with faster recoveries than those involving the semimembranous. The current study also successfully demonstrated MRI distribution and location of hamstring injuries in a professional soccer team, and this classification also enhanced the hamstring muscles complex anatomy at the myotendinous junction. There are several limitations that need to be considered when interpreting the results, including the limited access to data due to restrictions from MLS authorities, which may not be representative of the prevalence of injuries amongst FC Dallas team. The current study population was limited to male professional soccer players, which may not necessarily reflect the injury characteristics within a more general population. Also, this is a retrospective review of MRI findings in one MLS team. Ideally, a prospective study would predict the amount of time missed and determine the accuracy of our predictive model from the MRIs. As future visions, the findings of increasing trend in injury rates are worrying, and prevention of hamstring injuries should be given the highest priority. Research should focus on pitfalls and opportunities on implementation of eccentric strengthening as an injury preventive strategy in soccer. Hamstring injuries are complex pathologies that might not have a punctual answer, but research might be able to focus on cost-effective treatments to accelerate recovery after injury. The already known risk factors for these injuries should be considered by all teams as future prevention initiatives. Regarding PRP therapies, we do not have good evidence yet. There is considerable heterogeneity among studies, lack of good methodology, including randomized control trials and control groups. Also, no significant difference in time to return to play has been reported in the current studies, or they might be underpowered to show a difference if one existed. Further research will be required to better understand the indications and ideal composition of PRP for soft tissue injuries. Thank you.